Most of us know someone who struggled with depression, or maybe you've struggled with depression yourself. We know this to be true because of the survey we took a couple weeks ago, where 75% of us reported that we strongly agreed with that statement. I know that I, for one, have struggled with depression since I was about 12 years old. I can't say, though, that I've ever tried psychedelic drugs. I did go to a Tame Impala concert once, though, and I imagine that experience was pretty similar. Today, I'm going to talk to you about how psychedelic mushrooms are a promising form of therapy for depressed individuals. This issue is close to my heart as someone with depression and as the daughter of someone with severe treatment-resistant depression. Also, as a psychology student, I feel I'm equipped to talk about this after performing a literature review on the topic. Today, we're going to talk about the problem that antidepressants just aren't meeting the needs of depressed individuals. Then we're going to talk about the solution, psychedelic mushrooms used in clinical settings. Finally, we're going to talk about some of the opposition that this solution faces, namely the unfounded stigma against psychedelic mushrooms. I hope by the end I'll have convinced you that we need to do more research on this promising intervention for the people we know, the people we love. Depression is a major health concern. According to the CDC, 1 in every 6 people will experience depression at some point in their life. The typical treatment for depression is antidepressants or therapy, or both at the same time. Yet, antidepressants are known to have strong adverse effects such as sexual dysfunction, weight gain, and cardiovascular problems. Even more, it takes 2 to 4 weeks for antidepressants to show any benefits for the people taking them. The literature supports these facts, and I can also speak from personal experience. About 2 summers ago, I had to switch my antidepressants because I'd reached the maximum dosage of the medication I was taking at that time. That's another shortcoming of antidepressants. Your body will always eventually form a tolerance for whatever medication you're taking. So my doctor switched me to a different medication, and for whatever reason, it just did not work with my body whatsoever. I continued to feel extremely depressed, and at the same time, I started to have trouble thinking clearly and rationally, and I was very emotionally turbulent. I constantly felt out of control of my actions, my thoughts, and my body. It was extremely distressing. I felt like I was going crazy. It was a really unpleasant couple of months that my doctor was tinkering around with my dosage, trying to find something that would work for me. But because antidepressants take 2 to 4 weeks to start showing any benefits, I just had to hope that it would eventually get better. Thankfully, after 6 months of feeling miserable, my doctor just switched me to an entirely different medication that luckily worked better right away. But this experience is not unique, and many people experience much worse symptoms than I did. Even more, 1 in every 3 depressed individuals are treatment resistant, and my dad is one of these people. My dad has struggled with depression for the past 45 years and has never found a treatment that helps him with pharmacology. For people like my dad, we need better options to help them out. At the time that people are actually seeking help for their depression, they can't afford to wait 2 to 4 weeks to maybe feel better. They need help, and they need it now. Psychedelic mushrooms are a more immediate way that we can help these individuals. There have been a couple of studies done that show the safety and efficiency of this type of intervention. For instance, in 2021, Rootman and colleagues did an experiment where they surveyed people who microdose and non-microdosers. Now, microdosing is just taking a small amount of mushrooms over a period of time. They found that in their sample of people reporting mental health issues, they reported if they were taking small amounts of psychedelic mushrooms, they reported far less stress, anxiety, and depression compared to their non-microdoser sample. Additionally, Romeo and colleagues performed a meta-analysis in 2020 where they looked at 8 different studies that were looking at psychedelic mushrooms and mental health. They found that across all 8 studies, not a single one of them reported serious adverse effects related to psychedelic mushroom use. These 2 studies, among several others, show how psychedelic mushrooms are efficient and safe for use in these settings. However, I would like to say that if you just went out on a whim and took psychedelic mushrooms, it's not going to cure your depression. This is seen clearly in Matsopoulos et al.'s 2022 experiment, where they surveyed people to ask if they had taken psychedelic drugs just at any point in their life, whether it was years ago, once or twice, recently, whatever. And they found that in their psychedelic mushroom using sample, they reported far more anxiety and depression. So obviously, taking psychedelic mushrooms on a whim without the proper knowledge or supervision to do so is just not going to be effective. Psychedelic mushrooms are a promising intervention, but it needs to be administered and supervised by a trained professional. This is how we can safely reap the benefits of psychedelic mushrooms. So if psychedelic mushrooms are so safe and effective, why aren't we using them? Well, a lot of this has to do with stigma surrounding psychedelic drugs. I mean, think about it. When people think about psychedelic drug use, they usually imagine the spaced out, lazy philosophy major staring at the wall, saying something to the effect of, "Dude, what even is?" As a double major in philosophy, I know the type, and I'll admit some of those stereotypes are true. But just because some stereotypes are true and the stigma is there doesn't mean we need to chuck the whole idea out the window. Yes, some people use psychedelics for the wrong reasons, but when they're used in the right way, they can bring great good. And we've known about this for a really long time. The indigenous peoples of the Americas use psychedelic mushrooms to treat both emotional and physical ailments. There's even cave paintings and sculptures from post-Paleolithic and Neolithic eras of psychedelic mushrooms. I'm particularly fond of this mushroom man here. Very creative work there. So clearly we've known about these for a long time, and we've known about their benefits for centuries. But it's been hard to do research on it because of FDA regulations. But as of 2023, the FDA released its first draft guidance on psychedelic mushroom use in clinical trials. So it seems like even the FDA is beginning to concede that psychedelics aren't so bad after all when used in the appropriate settings. Depression is a major issue, and we need better ways to help treat it. The stigma surrounding psychedelic mushroom use is strong, but not so strong that it can't be permeated with facts and reasoning. The research conducted thus far has pointed towards the plentiful benefits of psychedelic mushrooms, and even the FDA seems to be conceding that psychedelics need no longer be a topic of taboo. Now, please don't hear me saying to leave this class as soon as possible to get your hands on some psychedelic mushrooms. Try going to a Tame Impala concert first, and then let me know how you feel. Still, I hope I've encouraged you to think more critically about this issue. Think about the people you love and know who have depression, and if you didn't know them before, now you do. I would encourage you to open up your hearts and minds to see that psychedelic mushrooms are an integral part of the promising future of depression treatment.